All right, well, welcome. We're back to the program. So if you're having any difficulties, as I mentioned earlier, please feel free to send a note through our chat. It'll be open for in the next couple of minutes to address any of those questions, but we're going to go ahead and get started. Good morning and welcome to the Partnership Information Session on the Stay Home Work Safe Order. Before we begin, let me just run through the procedures for an optimal experience on our webinar today. If you are on a computer or a mobile device, you will be able to access our chat as well as our Q&A at the bottom of the screen. And chat will be open to talk to some of our operators if you're having any technical difficulties or just want to make a comment. The Q&A button at the bottom, however, this is where you can actively type in questions for our moderated session, which will begin after the presentation. So please do use both of those. For the Q&A session, only the answered questions will be accessible for the entire audience, so just keep that in mind. Also, for best viewing, you have a control at the top of your screen that says View Options. This will allow you to either enlarge the screen to see our presenters better, or you can actually reduce so you can see the PowerPoint presentation. And then if you are just joining us through phone, you'll only have the audio access at this point. However, this video is being recorded, and so you will be able to have access to the video post-event on our website. Again, the chat button is available to you if you have any technical difficulties. Our team is responding to those right now. So thank you. I'd like to go ahead and introduce Jenny Phillip, the Partnerships Vice President of Public Policy, and she'll go ahead and get the meeting started with our keynote speaker. Thank you. Jenny?
Great, thank you, Carrie, and thank you everyone for joining today. As many of you are aware and may have seen the press conference yesterday morning, Judge Hidalgo had issued a order to stay home and work safe. This was in conjunction alongside and endorsed by City of Houston Mayor Sylvester Turner. And the two tenets behind that, stay home, work safe. And we felt that it was timely to be able to address this with our membership in the business community to understand exactly what this means for each of us in our functions as employees and then also as business leaders in the Houston community. And so what we'll do is go through a series of questions at the end, but before that, Bob will go through some of the order, elements of the order to provide a background and just a foundational knowledge for how we execute on that order. So first question to kick it off, Bob, tell us more just about what is in this order and how that affects our kind of daily operations moving forward.
Well, thank you, Jenny, and thank you for this time. Thanks for everyone who's joined us on this call this morning. I appreciate the roles you're playing as leaders of Houston and leaders of your respective businesses, trying to take the appropriate steps in light of COVID-19. I also want to call out County Judge Lena Hidalgo and Mayor Sylvester Turner for the leadership they're providing throughout this crisis. We're in conversation with them almost daily. There are many issues that they're facing that they're trying to address, and certainly trying to stay on top of and in fact in front of as best we can this virus. So I do want to acknowledge the leadership role the two of them are providing and the fact that they're able to stay really joined at the hip at this critical time. I also want to thank the leadership of the Texas Medical Center. We've been talking with them on a daily basis as well. Under the leadership of Bill McKeon, who's president of the TMC, that group of leaders gets together every morning at 7 a.m. by phone to talk about the issues. And we've been talking to Peter Pisters at MD Anderson, Mark Boom at Methodist, David Callender at Memorial Hermann, Doug Lawson at CHI St. Luke's, Giuseppe Colasardo at UT Health, and Paul Klotman at Baylor College of Medicine. And I know there are others who are involved in the call, but all of those individuals have been interacting directly with the partnership as we try to develop a common stance on the key issues that we're facing. And as you've heard them say, and I'll come back to, the efforts at this point are to reduce the rate of transmission in Houston so as to reduce the peak incidence rate to that which our medical community can handle. So we're this idea of flattening the curve so that the peak incident rate does not exceed the capacity of the Houston healthcare system. That's been the objective now for a couple of weeks. That remains the objective today, flattening the curve. And in that regard, let me go back to something that Mark Boom said yesterday, Dr. Mark Boom of Houston Methodist, regarding why are we taking these aggressive steps at this time. And he referenced a model that UT Health has developed to look at the impact of more or less aggressive steps by a community on the peak incidence rate in their community. So let me just quote some figures that Mark shared yesterday, and I think it'll make the point. We believe that by taking aggressive action now, that we can reduce the severity of the peak and actually have the peak occur sooner than otherwise. So the model that UT Health has developed would suggest that a very aggressive stance by Houston now would have the peak occurring on roughly April 7th. Just think of it as 2 weeks out. We would have something like 1,765 infections up to that peak, and that there would be 3,400 infections over the months surrounding the peak. 300 hospital admissions would be required, 200 of which would go into ICU. The point of that is that would be a relatively manageable outcome for Houston if we can keep it within those parameters. They also looked at the impact of delaying just 1 week these aggressive actions. That would move the peak out by another week to roughly April 15th. It would increase the number of infections from 1,765 all the way up to 13,000 infections. It would take the total number of infections surrounding the peak up to 24,000. It would take hospital admissions up to 2,100, ICU admissions up to 1,300. You can see a very substantial increase relative to the more aggressive scenario. Now, fortunately, we have about 10,000 beds across the Houston community. So even though that would strain our system when you take into account that not everyone in the hospital is in the hospital due to COVID-19, that would also be a reasonably manageable but not ideal outcome. If we wait 2 weeks to take more aggressive action, again, the peak moves out another week, but more significantly, the number of infections up to the peak jumps up to 83,000. The number of hospital admissions jumps up to 13,000, the number of ICU up to 8,300. Now, those numbers clearly exceed the capacity of the Houston healthcare system. So not to suggest that these numbers are precise, they're not meant to be, but you certainly see the magnitude, the general magnitude of the impact by moving in a more timely and a more aggressive manner. And I think it was that decision by our leadership over the last 2 days that said we need to take this next step to move to the stay home, work safe order. I should add that we have been engaged with the county and the city throughout this process. We have been part of the discussion as to both the need for such an order and also the specific details of such an order. We've worked and talked directly to the people who've modeled this and have been influenced as others have by that work. So let's move now to the order itself. I think that's probably why you called, is to try to understand better the order itself. The order calls for all people to stay home unless they're engaged in essential activities. All people should stay home unless they're engaged in essential activities. It does say that essential businesses can remain open, and the order exempts essential workers covered in the 16 categories as designated by the Federal Cybersecurity and Infrastructure Security Agency. People tend to call that CISA, but it's spelled CISA. And they've included those 16 categories in the order as being essential businesses. And they've also included a handful of other industries, such as commercial and residential construction. We'll come back to that in a minute. Now, individuals may leave their residence under this order only to perform essential activities, which again are enumerated in the order. Some of those activities may be to perform the function of an essential employee working for one of these essential industries. It's important to note, citizens do not have to shelter in place or lock down. One of the reasons that the leaders in the city and the county moved away from the shelter in place language is that Houstonians associate a certain meaning with that phrase, typically associated with hurricanes, associated with industrial accidents, things of that sort, and that really doesn't fit here. So what can citizens do? Grocery stores, pharmacies, gas stations, parks, and other areas do remain open and accessible. You can also perform other tasks essential to your health and safety or to the health and safety of your family or household members, such as obtaining medical supplies or visiting a healthcare professional or obtaining supplies for someone who they need to have to work from home. You can also exercise as long as you keep social distancing in mind. So you can go out and walk and jog, but please keep that idea of 6 foot distancing in mind when you do so. As you know, bars and nightclubs will remain closed. They were already closed. They will remain closed. Restaurants can only open to the extent that they're offering takeout or delivery. No in-room dining is allowed, and that's been the case now for several days. So let's pause for a second. Let's think for a second about the exempted sectors, this very important notion that the federal government had already outlined what were considered to be essential industries that are needed to keep the entire country operating adequately. Those are accessible on a website called CISA.gov, CISA.gov. They're also outlined in the county order itself, which is now available on the county website, and it's also available on the partnership website. So let me give you an example of a few of the 16 sectors that are considered essential, and these are sectors that I'm going to mention that are more important to Houston: energy, healthcare, chemicals, telecommunications, critical manufacturing, financial services, food and agriculture, information technology, and transportation systems, which includes the critical activities of the Port of Houston. Critical manufacturing is defined as those manufacturers who are supporting one of the critical industries. So I think this definition of critical manufacturing is that manufacturing which supports a critical industry is important for everyone to understand. Now, that doesn't mean that all employees working at an energy company, for example, are permitted to go to the office. Only those that are absolutely essential to keeping the operation going are deemed essential under the county order. So I encourage you to visit the CISA.gov website, read the PDF on the county order. If you go to the county site, you'll see a reference to a PDF. That's where the details are. They give examples of the essential roles at essential companies. Now, in addition to the CISA designated sectors, we're pleased to say, frankly, that the Harris County order did also exempt other sectors. I mentioned earlier, residential and commercial construction are deemed essential under this order here in the Harris County. Property maintenance is deemed essential, and that includes plumbers, electricians, exterminators, yard and maintenance crews, housekeepers, janitorial staff, pool cleaners, and other service providers who provide services that are necessary to maintain the safety, sanitation, and essential operations of residences and essential businesses. NASA and the Port of Houston in their entirety are considered essential and exempt under the order. Essential retail, which includes those things primarily related to food and beverage, production, distribution, and retail, are included as essential. And as I mentioned earlier, restaurants are essential to the extent that we're talking about takeout, delivery only type activity. Also included in essential retail are food warehouse stores, furniture suppliers, big box stores, liquor stores, gas stations and convenience stores, farmers markets that sell food products, and household staples. Essential professional services are exempted when necessary to comply with legally mandated activities. If you need to complete an audit in order to submit something to the SEC, that would be an essential professional service, by way of example. So the link is very lengthy. You'll need to really read it closely to see how it applies to your particular business, whether your company is exempted or not. But again, even if you have an exempted company, all of your employees are not necessarily exempt. You should be determining what the essential functions are. We'll come back to that in a minute. Now, everyone's asking about enforcement. And let me say first that the intent of this order, as stated by both Judge Hidalgo and Mayor Turner, is to encourage Houstonians to operate responsibly, to behave responsibly, for people to do the right thing. No one believes that enforcement per se is the answer to this. We're trying to encourage the appropriate behaviors. However, there are enforcement provisions. The order authorizes any law enforcement agency in Harris County to enforce this order with a fine not to exceed $1,000 or a jail term that does not exceed 180 days. So really significant enforcement provisions. But again, the intent is not to rely on those as much as to rely on the appropriate responsible behavior by Houstonians. Now, I'm pleased to say that there was a waiver process developed as part of the order, and requests can be made by businesses to be considered essential. The business must provide evidence that the business is essential to promoting the general welfare of the residents of Harris County. That's what you must argue and present in your application. The county is currently developing an application process, which will be made available at readyharris.org. To my knowledge, it's not yet available. It should be available very soon. So Jenny, let me stop there. I know there's more we could talk about, but we'll probably best to shift to the questions. But let me just end with the name of the order: stay home, work safe. That's the essential message of this order, above and beyond the details. So Jenny, I'll return the floor.
Sure. You know, Bob, on the work safe portion, I know that there were some you know, ways that the judge and the mayor had suggested employers could act to be able to help flatten the curve. Could you articulate a few of those actions that the partnership is hoping the business community can support?
I think there's a couple of ways, and then we'll get into some detail in a minute. First of all, this idea of identifying who the critical employees are, and to try to minimize the number of employees who are truly expected to come to work. We'll come back to this in a minute, but this idea of what is really essential to maintain the operations of your business. And for those that are required to come to work, how do you maintain a safe working environment? So working with the city and Harris County and others, we've developed a concept of what we're calling COVID-19 Houston Work Safe Companies. Call it a program. COVID-19 Houston Work Safe Program, where companies, though, would self-identify around a number of key principles. Let me walk through those principles with all of you this morning. These are principles designed to keep your employees safe and your operations secure. The first of the 10 is to allow all but critical on-site employees to work from home, to really take teleworking as far as you're able. And I think all of us are finding that we can do more at home than we thought we could, particularly when we provide the appropriate technology support. So many of you will need to maintain some degree of on-site workforce, even in some office settings, but it's to try to minimize that as best we can. Number two is to employ video technology in a fashion that allows your employees to work effectively from home. Avoid the necessity of face-to-face meetings by applying technology such as Zoom, Skype, Microsoft Teams, or other applications to conduct meetings. Make sure your staff has those tools and knows how to use them. Encourage their use. We shouldn't feel the need for face-to-face meetings. Three, create a safe work environment for all your critical on-site employees. The employees that you need to bring to the office or to the workplace, maintain a physical separation for them. Health officials are advising at least 6 feet of separation to avoid possible transmission. Employers should establish protocols that require all on-site employees to maintain a distance of at least 6 feet while working. That can involve rearranging workstations and a number of other such steps. You should close communal spaces at your office. In other words, discontinue the lunchroom, the break rooms, the meeting rooms. At this point, people should not be gathering in such close proximity face to face. And of course, expand your cleaning operations to make sure that the workers who are coming to the office are safe through extensive cleaning protocols of all the high-touch, high-traffic areas throughout the day. Number four, require sick workers to stay home. Anyone who is experiencing even the mildest of symptoms should avoid the workplace. You should send that message very clearly to your staff that anyone experiencing symptoms should stay home, not come to the office. And of course, if they start experiencing symptoms during the day, they should immediately leave the office and go home. Number five, look at your paid sick leave policies. Make sure that they're not providing a strong disincentive from people self-reporting illness. At this point, we should give every encouragement to employees who are sick to stay home, or frankly, who have members of their household who are sick. They should also stay home. Number 6, encourage proper hygiene. We've been talking about this now for weeks, providing sufficient hand sanitizing stations, guidelines for proper hand washing, soap at all hand washing stations, what have you. I think you're familiar with that. Number 7, for those employers who need to come on site, think about creating alternative teams where not every critical on-site person is at the workplace every day. People are going to morning and afternoon shifts, more frequently every other day or even every other week shifts, so that only half or so of their critical employees are working at any one time. That keeps you from exposing your entire critical workforce to a single case. Number 8, restrict on-site access. This is a time to either prohibit any visitation, guests or other visitors, or to establish standards of ensuring that visitors meet a protocol by self-identifying any issues they might have had, any travel that they've done, anything that would suggest a reason for them to be kept off-site. And that touches on number 9, discontinuing work-related travel. I think most of us have done that already, but also the idea of asking our employees or requiring our employees to report even personal travel. This is a point where we need to know where our employees are traveling. So if there's a report a day or 2 or 3 from now of an outbreak where they were, we have some ability to go back to them to try to limit the exposure of that employee to the rest of the workforce. And lastly, we should establish anonymous reporting for work-safe issues, just like we have for other issues in the workplace. It should be possible for employees to report situations or circumstances that they don't deem safe with respect to the transmission of COVID-19. Let's give them the opportunity to report that just like they report other workplace issues. Now, you can find a copy of these 10 principles on our website, which, as you know, is houston.org/coronavirus. I do want to say that companies who adopt these principles are encouraged to publicly declare their pledge to do so. This is a self-assessment. Our website will have a form for you to log your participation in the program. We encourage you to do so. We've also posted a COVID-19 Houston WorkSafe Company logo at www.houston.org/coronavirus for companies to download, to display in their workplace and on social media. Companies are encouraged to use the hashtag HoustonWorkSafe, hashtag HoustonWorkSafe, to acknowledge that they're taking these steps for their employees in their workplace. So we want to identify the companies that are doing this. So the point is, even with this order from the county, it still depends heavily on the voluntary behavior, if you will, of Houston employers. And this is a way to encourage and acknowledge those companies that are taking all the appropriate steps to maintain a work-safe environment. So Jenny, I'll return the floor to you.
Okay. And just a reminder to everyone who's listening in to please go ahead and submit any questions. Bob, let's go through sort of a rapid fire round of some of the questions we've already received. There's some desire to understand what the guidance is behind employers and what they should provide their employees who are concerned about traveling during this period, because as you had mentioned, there is a level of enforcement that will be done. And so what assurances can employers provide their employees about traveling to work if they're deemed essential?
I think it's very important that employers communicate directly with those employees that you have deemed to be critical. Give them something in writing that says they have been deemed to be critical, something that they can carry with them. We refer to that as a safe passage letter. We've provided an example of such a safe passage letter on our website. You might want to look at it. But I think the employees at this point are nervous about traveling under the presence of this order without something that they could show to demonstrate that they have been deemed an essential employee of one of these essential companies.
I mean, almost a different perspective on this. Another question is the contrast, as employers, what can we do to ensure that our workforce takes these orders seriously?
Yeah. Well, I think everything we can do to signal to our employees that as business leaders, we're not resisting the idea of taking these steps as a community, that we should show our support for flattening the curve. We recognize the pain it's doing to both the employees and the businesses to operate in this fashion. But if we can all help articulate this case, why are we doing this? Why is it important? And why is it important to get virtually universal acceptance of these principles for us all to be safe? That would be very helpful.
Mm-hmm. And one common question that's popping up is, how does this order change what's already been put in place prior?
Yeah. I think it's going to force a couple of things. One is it does force businesses to really assess and establish whether they are indeed a covered essential industry or essential company. I think there are a lot of companies that will see that list included in the order and realize quite clearly that they are essential, so that'll take away that question. But for other businesses, I think they'll have to ask themselves, hey, do I really need to be operating today? I probably don't, and I probably shouldn't be, despite the economic implications of that for the company, perhaps. So I think it will force that kind of thinking. Specifically, relative to what was in place prior to the order, there are some other groups now that cannot operate: gyms, fitness centers, public swimming pools, hair and nail salons, spas, licensed massage businesses and tattoo parlors, concert halls, live performance theaters, arenas, stadiums, movie theaters, game rooms, bowling alleys. It does go on and on. There are a number of areas like that which prior to this order, you could say could operate. They weren't considered bars, clubs, or restaurants, but now under this order are expressly told that they must stop conducting business. And that's true as of midnight last night. So these businesses should not be operating today. Again, this puts a lot of burden on those businesses, but it's certainly, in light of what I said earlier about the model and the results that will otherwise happen in this community, they're necessary steps.
And so another question too is focused on when the order is lifted. The judge put out the date of April 3rd because of following state guidance, but we know that that also includes the option to extend if we're not seeing that flattening of the curve, or that we're seeing ourselves coming out from that. So from your perspective, when looking ahead, when will this order be lifted? When can we start returning to normal operations?
Well, just as you said, Jenny, the order references the April 3rd date. No one should misread that. There's no expectation, frankly, that this order will be lifted on April 3rd or April 4th. That would be a very, very optimistic scenario. I mentioned earlier the study done by UT Health and when that peak might occur if we take aggressive action, the most aggressive actions right now, that would suggest, the model would say April 7th, so just call that 2 weeks out. Many conversations I'm having with leaders in the medical center suggest that that's a very optimistic scenario. Again, we should probably be thinking 2 to 3 weeks out, 3 to 4 weeks out. And that's just relative to the peak. We need to realize that beyond the peak, you still have a high incidence rate. We'll still be taking steps like this. So in all likelihood, we should be thinking months, not weeks, for a fairly significant clamp down, if you will, on this kind of activity.
Another question we received is that you spent some time going through those critical infrastructure sectors that CISA had recommended and that the county includes. You also included additional industries such as construction that the county added in. But overall, even though that seems fairly expansive, we know that there will be severe, economic implications, negative impacts. How do you feel that this order ultimately will impact the Houston business community?
Well, I think the steps we're taking to deal with the virus are entirely appropriate, and they avoid the potential of a New York City type outcome, a Northern Italy type outcome, where the economic impact would ultimately be much, much, much worse. That being said, however, the steps we are taking and the impact of the virus, even up to this point, are going to be quite significant for Houston. People are acknowledging now that we probably have already entered a national recession. We're entering a Houston recession. We're going to see very quickly impacts on business and government revenue and every other aspect of the economy. And of course, here in Houston, we're dealing with the combined effects of COVID-19 as well as the collapse in oil prices and issues that we were beginning to face irrespective of the virus. So it's going to be a double hit on Houston. The partnership, we are already spending time thinking about how do we position Houston for a strong recovery. But that is, probably weeks and months off from really being a focus of our efforts. But this is going to be hard on Houston. I think people making day-to-day decisions with an eye towards the fact that this is going to continue for a while. We shouldn't be thinking that we can just hold our breath for a week. When you think about managing your cash as a business, thinking about the decisions you're having to make, making them with an eye towards both a fairly lengthy period of the virus and then what may be a very soft economy for some period of time thereafter is probably the appropriate perspective.
Well, that's about the list of the questions that we've received, but I wanted to allow you some time if you wanted to provide any closing comments, remarks before we conclude.
The essence of our conversation with Judge Hidalgo and Mayor Turner over these last couple of weeks is how do we fashion a set of actions that are uniquely appropriate to Houston and take advantage of the fact that Houstonians, frankly, I think will respond to leadership signals as they have in other previous incidents like the hurricane. So we ought to be thinking about what messaging we're providing, not relying totally on the orders per se. And so my request of all Houston business leaders is to take this seriously, be thoughtful, frankly, be aggressive in the actions you're taking in the short term to avoid all of us having to take much more aggressive actions on down the road. So I'm very confident that Houston business leaders are prepared to do the right thing, and they're doing the right thing. You've now been given a little bit more guidance as to what the right thing means here in the near term. I hope you take it very seriously. I hope you lean as much as you can on the partnership for information that you need, and frankly, to let us know of actions you think should be taken or shouldn't be taken in light of these circumstances. But thank you for your attention this morning.
Yeah. Thanks, Bob. And thanks again, everyone, for joining us this morning. As Bob mentioned, the partnership is working at producing resources and responding to questions and concerns of the business community, working alongside our local officials to work through this period. And there's quite a bit of new programming that we've been creating. Just yesterday, we had an SBA webinar. Tomorrow, we'll have a discussion on workforce with Insperity and TWC. And we'll be continuing to have this programming throughout this period. And please reach out if there are any questions or topics that you would like the partnership to address. In the time being, the partnership website, houston.org, has quite a bit of the resources that we referenced today. And we hope that everyone stays safe and healthy through this period. So thank you all for attending.